Hello, this is Moshe Heller from the Moshen Center and Moshen Herbs. I want to thank the American Acupuncture Council for letting me present today on this topic of treating children with seasonal allergies. This is a lecture, I'm sort of repeating a lecture that I did exactly a year ago, also talking about this subject, but spring is here, and it is the time to talk about these things. And we have lots of patients that we need, or at least I'm seeing a lot of patients who are in need for help in this season with allergies. So now we can go to the slides, please. So the spring is here, as I mentioned, and there's these when spring comes, and as practitioners of Chinese medicine, we always need to say to be in touch with the changes of the season. We feel those fluctuating temperatures, the blooming plants and trees, and that all brings these sneezing and sniffles and runny noses and irritated eyes and scratchy throats. And these are all signs of these seasonal allergies. And today we'll discuss how we can help these patients with both acupuncture and herbs. And I want to point out that when we talk about seasonal allergies, this is a range of diseases that can manifest in various ways, starting with allergic rhinitis, and enlarged adenoids, and that affects the sleep, can cause sleep apnea, and children who have a tendency to have seasonal allergies will also tend to have some food allergies, and we'll talk about why that is happening in a second. Um, we have to understand that there's a reaction of our immune system which causes an inflammatory process, or an allergic inflammatory process, and we need to address that from in multiple ways. I just want to remind you, this slide reminds you that there's a lot of times the spleen or our digestive system is at the center of this disease process of the pathology, and we have a weakness a lot of times of the spleen and stomach, which then does not support the um, lung appropriately, and therefore our Wei Qi is imbalanced and overreactive, and that our spleen also produces phlegm and dampness, which goes upwards and affects the orifices. So that just points out that when we see children with allergies, I always discuss diet, because for me, there's always a relationship between allergies and our diet. So when we suspect there is an allergy in the pathology, then we always have to talk about, are there any phlegm producing foods that they are consuming, and how we can change that in order to help in resolving the issues that are presenting. It's really important to just start by asking what they eat on a regular basis. What's their diet like? I always say, what do they eat in the morning? What are their snacks? What are their lunch like? What's their snack in between lunch? What's their dinner like? And that helps me really understand what they tend to eat, and is there any contributing factors for that. And so always consider giving a 3-week food journal. That is extremely helpful. I found that to be very helpful when I have patients do that, and when they actually report that, then we can see what they're eating and have a discussion about diet. So when we talk about pattern differentiation in these conditions, we always look for, is there any lung or spleen Qi vacuity or deficiency, or what we see a lot of times in Chinese in pediatrics is that there could be a situation where there is what we call hyperactive spleen Qi deficiency, where the patient is actually having a spleen deficiency, but their behavior is very hyperactive and doesn't really match the deficiency symptoms that they are presenting. Um, I always also look to see if there's any lingering pathogenic factors. As we know, lingering pathogenic factors can be a very common cause of disease in children. One telling sign is that their lymph glands under their um, mandibles are swollen, and so I'll palpate that, and if they're swollen, I'll start to ask questions about lingering pathogenic factor. Was there an illness that was never fully resolved or has been chronic, and that could be the trigger. There could be also a liver yang rising. Children also can manifest with liver yang rising, and sometimes emotions. When we talk about liver yang rising, a lot of times emotional factors can be part of that situation. So what we may need to note is that each of these patterns may have bouts of either wind cold or wind heat attacks, meaning that it's concurrently a wind cold or wind heat that's attacking on the surface. And it can be also complicated with wind phlegm dampness. In some cases, there could be an underlying kidney involvement, a kidney vacuity. And what we always need to understand that when there's an allergic condition, that when there's an allergic condition, there's always some heat hidden, or it's the heat is coming from somewhere. It could be yin fire, it could be qi stagnation, and it could be phlegm congestion. All these are possibilities, but there always is a heat source or a cause for the heat to be present. So when we talk about allergies, it means that there is an hyperactivity of the immune system, meaning it reacts at the times that it's not supposed to react, and therefore um, that's for me always represents a heat condition or a hot condition, that it could be deficiency heat, could be excess heat, but there's heat somewhere in the system and we need to figure out where it's coming from. So again, once we come with have a diagnosis, we always can consider these different points. Our main points are always lung 7 and large intestine 4 to help resolve the exterior aspect of that. Do 23 is a point that I use a lot for clearing of the sinuses. So if there's any accumulation, congestion, runny nose, anything that we need to address in the sinus area, do 23 helps to clear both damp and phlegm and wind and cold from the head. So that's a very important point, as well as gallbladder 40. Gallbladder 40 is a really important point, and sometimes I may use moxa on it or just needle it, depending on the presentation. And that's a very helpful point to, especially when we have rhinitis as part of the presentation. Liver 3, if there's a lot of heat and the face is red and you see symptoms of heat in the upper part, in the facial area, then I would consider liver 2 or liver 3 if they're not. Um, Always remember this area between large intestine 10 and large intestine 11, maybe towards the triple burner line, is what we call the immune regulation area, and I check for sensitivity or puffiness, and address that area also if needed. Um, Triple burner cis 16, triple warmer 16 is also a very important immune point and help to regulate the lymph drainage in the neck area. And so that's a very important point that I consider, as well as do 12 if there's lung qi for lung qi regulation and activation of the thymus gland. This is why we would choose do 12. And I always palpate the spine and needle very tight spots and look at areas like do 2, do 3, and or do 6. So these are areas that I check to see if there's any irritation. And we could use needles. For some children, I might use Shonishin technique. And I always want you to remember that Teishin is meaning the needle that is non-skin penetrating is always has always been part of our 9 traditional needles. And we just need to understand that when we're stimulating the skin, we're stimulating the depths of our nervous system and also our chi. And therefore, it's important to remember that we don't necessarily need to use a needle in for all these points, but we can definitely use Teishin or non-needling techniques or non-insertion techniques. I also want to point out, we're shifting a little bit to talk about herbs. One thing I want to point out is this um, research studies that was done on stabilizing mast cell activity, and so there is a formula that was used. It included 3 Chinese herbs. Those are this formula is called Shuang Huang Lian, which is Jinin Hua, Flos lonicera, Radix scutularia, Huang Qin, and Forsythia lianchao. So these 3 herbs really help to regulate mast cell. And I'll also mention that I'll show you a product in a few seconds, which is made from quercetin, bromelain, and nettles, which is a great combination to also help regulate or down-regulate mast cell activity, similar to what this formula might be doing. So you can use these 3 herbs as a component in other traditional formulas that you might be using, or according to the pattern differentiation, to help with down-regulating mast cell activity. I also want to mention another research study that was done by Dr. Lee from Mount Sinai. She used a formula. She used another traditional Chinese formula, Wu Mei Wan, to address food allergies in particular. But in my experience, it will definitely also be a good formula to consider in environmental allergies. And the formula is this is the traditional formula. It has it's known for its Jue Yin. This is the main formula in the Jue Yin, which addresses also parasites. And that's why I think Dr. Lee chose it, because of the parasite theory and allergies that you can definitely read on in this. You have the research study right here, and it points out, and this is actually the formula that was finally used in the research. This is the product I was referring to. It's called DHIST. Again, it's made from quercetin, bromelain, and nettles, which are all help in regulating allergic, or the histamine response, regulating histamine response. And there is a pediatric version, a DHIST Junior chewables. I usually give this in larger quantity than is recommended on the dosage, because I believe that the quantity of quercetin needs to be high in order to downregulate or get a better effect on the for the patients. So I sometimes double or triple the amount of the DHIS that I would recommend for patients. I hope this helped you very to address some of your patients' concerns, especially when it comes to allergic responses. I see a lot of patients in my office, especially in this season, but also throughout the year, especially with food allergies. And so I hope this helps, and I want to thank the American Acupuncture Council again for letting me speak today. Thank you very much.